Are you experiencing any of these symptoms? If yes, then you should check your blood sugar levels because all of these symptoms point towards the silent killer, diabetes. Yes, diabetes. Diabetes is one of the most common lifestyle disorders with a global prevalence of 9.3%, affecting around 463 million people worldwide. It is quite aptly termed as the silent killer because most of the people do not have any symptoms in the beginning or they fail to recognize the early signs and symptoms. But the real reason that this disease still remains a silent killer even in 2022 is due to lack of education. So, to mark the World Diabetes Day 2022, the International Diabetes Federation has come up with the theme Education to Protect Tomorrow. So, let's learn about diabetes. Diabetes is a chronic condition in which the body produces excess blood sugar levels due to underlying causes such as genetics, lifestyle practices, hormonal imbalances, exposure to certain viruses, etc. Most of us are aware about type 1 and type 2 diabetes because they are rather common. But there are also many other forms of diabetes which are less known but still affects 2% of the population worldwide. These are some of them. Based on the type and the severity of the condition, the diagnosis and the treatment plan varies. But do you always have to wait around for these symptoms to show up and then go for your treatment plan? Well, no. You can be proactive, take a few lifestyle measures, and keep this disease in your control. Here are some of them. Follow a low sugar diet. Always opt for complex carbohydrates over simple and refined sugars. Tie up your shoelaces. Be physically active at least 5 days in a week for 30 minutes to 45 minutes and avoid a sedentary lifestyle. Limit your alcohol intake and quit smoking habits if you have any. Keep away the stress. Engage in yoga, meditation, or do any activity in which you feel relaxed and keep the stress away. Don't forget the extra nutrients. Always ensure that B vitamins, vitamin D, magnesium, and omega 3 reach you either through your diet or through supplementation. Get regular checkups done. Whether you are not diabetic, are pre-diabetic, or are having diabetes, it is always a good practice to check your blood sugar levels routinely. And the best practice of all, get a genetic predisposition test done. Check your genes, know if you are at risk, and if you are, take the necessary precautions to keep your genetic risk at bay. Diabetes will only become a silent killer when we remain silent. So, choose to be active, choose to be healthy, and let us all together silence the silent killer.